So now we're at the simple stage of the training where we uh, apply all the things we've talked about so far into the concepts of using technology in the provision of rehabilitation services. And I hope you've been thinking about that as we've worked through all of the content so far. So technology in the context of rehabilitation is telehealth, sorry, in the context of rehabilitation is the use of technology to provide services at a distance in some way, where the clinician and the or the resource and the person using them are remote from each other. As simple as that. It's a very wide-reaching thing, and as you will have found in the article by Camden and Silva, there's a lot of activity in this space. There is some things are clear. A lot of stuff has kind of emergent, soft sort of evidence, you might say, supporting the use of concepts that we've used before, delivered through the medium of technology, some kind of medium of technology. Some things definitely work better than others, though. In terms of direct research in pediatric rehabilitation around the use of telehealth, it's very much at that emergent stage. And so it's a matter of what are some of the key messages that we can pull out at this point. There's going to be prolific amount of stuff coming out about this in the next couple of years. So one of the first things that we as a team felt was most striking about this synthesis of telehealth and pediatrics by Mindy and her colleague Camden is the idea that, you know what, a phone call and a text and an email, that is telehealth. That is telehealth. So it's not necessarily the really, really fancy stuff, some thing that's well, huge, expensive, and requires a bunch of training in how to use. It's about thinking about how could technology support us to meet the needs of families. Your homework, your pre-reading homework was to think about, you know, red, orange, and green, thinking about what are you already using? What have you not thought about using or not thought of as part of the delivery of services? And what are some things that are complete kind of no-goes for you, either because of it's not going to be a funding option or that's just far too much technology learning for where I'm at currently. So it's fantastic everybody's thinking about that. Now, just microsecond, just to say, another way of thinking about how we're using telehealth is thinking about it at the different levels of service delivery. So Sevi's just given a lot of great examples of the use of technology to augment, add to what we're already doing at the individual level. Technology gives us an opportunity to rethink what might we be doing if at the second tier for servicing a large number of people. Access to services we know is a big problem, scarce resource. How can we service a larger number of people using technology to support what we do? So a really obvious little example might be a Zoom family education problem solving session, as opposed to scheduling everybody come in and travel time, childcare, etc. What advantages could there be through using the technology? And thirdly, if we think about the types of services that we offer at the population level, free open access to all, maybe more of a one way, not tailored or personalized care, but a resource, educational resource is made available to the wider public. For example, the curriculum for your Thriving with Autism course that your service is awesomely being run out of the back room for the last 5 years. What about putting all the speaker notes and PowerPoint up on your website? Some people will bump into that, find it when they go looking for it, when it's just the right time for them to need that information. And it's cost nothing in the service time to put that up there. And of course, you can get fancier than that, but just a different idea about thinking about this issue around access and scaling of services at different levels in the scale. Just going to plonk that framework there for you now and hand over to Mindy. Mindy, are you okay with me controlling the slides? Would that just be
Yep,
quickest?
that's good. Thanks, Vee. So that's a lovely segue into what I want to talk about, which is how we actually use technology. So just, I guess, a full disclosure, my thesis is about the slide on the right, which I'm going to talk to you about. So I haven't done a lot of telehealth one-to-one video conferencing in terms of delivering healthcare services. My background is more in delivering is in looking at how we use technology as a whole to deliver services. And so these two pictures, what they represent, here on the left is the computer. If you think about the computer as a tool, as a really powerful calculator that helps us do maths much more easily, or as a really useful tool to help you be more efficient or effective, then there's this idea of the computer as the tool that helps you. And then on the right hand side, there's this idea of the computer actually, because the computer is responsive and reactive to what you as a user put into it, the computer actually can mimic some social skills that we have as people. And so it can be charismatic, it can have personality, it can develop relationships with people that you wouldn't necessarily see with just a calculator. So when it has the ability to use your name to deliver you things that are interesting to you, because it's used algorithms to figure out what you need, then you start to see this computer as a little bit of a personality. And instead of it just being a tool, it actually becomes an active participant in the delivery of services when you're using technology. And so if you just click through to the next slide. So I've kind of just put the technical terms here in the way it's understood and researched. The first one is computer mediated communication, which is what most of us think of around telehealth, where you think of using the computer as a tool in order to deliver your communication to the client or the patient or the family. So that's the teleconferencing, the emails, the texting, the phone call, all of those things. And those have been around long before COVID, maybe not so much the teleconferencing and the Zoom, but certainly emails, texts, and phone calls have been around and called telehealth for a very long time. And then on the other side of that, we've got this kind of charismatic computer where there's this human computer interaction. So you're, as the therapist, maybe taken out of the loop between that communication, but you might be involved in some way in deciding what interactions happen, but you're not actually necessarily involved on that one-to-one basis where you can just set things up and things can happen without you being there. So that's using things like web platforms and apps, and that starts to get into much more technical digital stuff like gaming and virtual reality and artificial intelligence and that sort of thing. And if you'll just do the next slide. But really the most important thing to think of when we think about telehealth and e-health and using digital technology is that the human is in the loop. So we want to remember that telehealth is about technology, but it's also about people and about both the therapist and the client and what they're doing. If you could jump to the next slide. So when we think about all of those things together, the computer mediated communication, the human computer interaction, and then the human in the loop, we come up with what we talked about in that paper, Chantal and I, that was the hybrid approach, looking at using the computer for both synchronous communication, and synchronous just mean being at the same time. So like we're doing now, I'm live, you're live, and we're having a conversation in real time, versus asynchronous, which is what you can do with, say, texting or emails, where you can send somebody a text and they can read it at a time that's convenient for them. And then the asynchronous as well, with like web platforms and apps where people can use it at times that are convenient. And then of course there's the in-person and the virtual, which is when you think about computers and using computers to augment your therapy, you don't only have to think about computers as in now I'm doing e-health and now I'm doing real therapy or in-person therapy, and that sometimes gives the digital technology a bit of a sense of being like the second cousin, like, oh, we just have to get through lockdown and then we can go back to doing what we were doing before, because this is kind of like, you know, the second cousin of what we really want to do. If you use digital technology well, it actually augments the therapy that you're doing in person, by being able to, I think as Sevi was saying, like just to be able to connect when you're not with that patient and augment and support the stuff that you're already doing. And yep, and then I've just got those technical terms at the bottom. So what I wanted to do was give you a bit of an idea of some of the apps that are out there and how they are using these different kind of features of technology. And Fee brought up SameView, which is one of my favorites. And this is a really great one to be looking at asynchronous communication. So that's where you don't have to be online at the same time with the person. And so the therapist or the parent or the caregiver or the teacher can take a picture of a child when they're busy doing something, and then the whole team can see it at a time when that's convenient to them. It's virtual, so this is really supporting the virtual aspect of technology, where you don't have to be in the same place at the same time, which a lot of parents have found hugely beneficial in terms of not having to navigate traffic, find caregivers, find parking, all those kind of things. So there's a real strength to having that virtual aspect to it. And this one is computer mediated communication. That's fine. So really the person doesn't have to be in the loop. The technology has algorithms that help people, sorry, the other way around. That one, the technology is augmenting the human-to-human communication. This one is the one that's human-computer interaction. So this is a lovely app that was developed as part of a research project looking at how we can support children with their home programs, and it used a lot of gamification. So this one, the therapist is really out of the loop for much of the interaction. They can set up the activities for the person, but then the computer takes over in terms of managing, encouraging, supporting the person just based on the algorithms that are built into the app. So there's a lot of rewards, a lot of encouragement, a lot of reminders to do your home program, all that kind of thing. So when you're thinking about this one, it's asynchronous. It doesn't have to happen with the therapist involved. It's virtual. The person doesn't have to be in the same room, and there's human computer interaction. In other words, the therapist is really out of the loop for this one, and that frees the therapist up to do a lot of other things that may be necessary. And then the last one, so this was actually Chantal Camden's, one of her projects that she did, and this was a web application for children with developmental coordination disorder. And so they developed this as something where you would go online onto like a web platform, and there would be things that were set up for parents to read and learn about. He was talking about that more kind of population-based approach to using digital technology. So there were resources that were specifically curated for the parents that would be relevant to them for their learning. There was a forum where people could ask questions, and the therapist would come in asynchronously, so at a different time, and answer them. So it made it convenient for everybody. But then there was also a synchronous component to this one, because parents could then ask for more support, or they could set up appointments, and you could do this one-on-one video conferencing to support a parent directly. So it's a nice example of kind of using the different ways that you can use technology, and you can kind of grab different benefits or different parts of each depending on the kind of platform that you're using. So thinking just a little bit more broadly about what you can do with technology. And what we haven't really nutted down really well is being able to tick all the boxes yet. So this is a imagine if we use technology in a way that not only facilitated the human-to-human communication and information sharing, but positioned it as an active player at the same time, so the computer itself could recommend solutions, make appointments, streamline processes. And we're going here into a little bit of, you know, the more technical algorithms, the artificial intelligence, the programming that needs to be set up in the background. But it's a nice way to kind of think system-wide about what we can do. Really, if we were to really maximize this idea of using technology and not think of it as a second cousin, but think of it as a really powerful tool to augment what we're already doing, and marry this kind of human computer coordinated thing. Okay, so that would really allow us to scale our services. And as we were saying, low resources, you know, everybody's got long waiting lists. The moment you can use computers to do stuff, a lot of the things that we do might be, you know, doing an assessment or a screening of somebody where you're ticking boxes, people can tick their own boxes, and then the computer can take that and decide, okay, from these things that leads you to this solution, and here's an example of something you need to be doing, go away and do it, and if it's not working, then come back and let the therapist help you, because that way you're freed up to help where you need to help and not doing things that could really quite easily be done just somewhere else. So really scaling services, not that one-to-one, but one-to-many. So this is kind of just, let's get real about what's really available to us as therapists right now in our current situation. And those kind of ideal things are important to think about in terms of where are we heading and where we want to go, but what can you use right now in your current situation. And so that's, again, just thinking, yes, it's a typewriter, but it's so much more than that if you think about a computer. And when we think about telehealth and digital technology, yes, it's a way of doing one-on-one video conferencing, but really it's so much more than that. And if you just move on to the next slide then, VS, just really, again, to reiterate that idea of thinking system-wide. So kind of not just how we do telehealth, but how we change our whole practice and think about, what do we need to do? How can we streamline appointments? How can we streamline services? I'll just give you a personal example. My dog's just come back from an operation, and the vet, they're quite seamless in the way they're using digital technology. It's quite, funny. I think it was Anna was talking about the dog learning augmentative communication. I think sometimes the animal world has it a lot better because they're not constrained by so much stuff that they have to get through. But so before the operation, I got a text from the vet saying, remember not to feed Diablo, that's my dog, remember not to feed him after 9 p.m. tonight. And then afterwards, when I went for my checkup afterwards, I saw a different vet, but the vet had all the information on their computer about what had happened in the previous consultation, and she was able to kind of read back to me what we had last said and what was next steps. And they were able to link me up with some helpful resources that I could just check up online in terms of managing the situation. So they're kind of using this whole systems approach, and they're using the in-person, the digital, the texting, all of that to kind of give me a very holistic service that made me as a patient feel quite supported. And if we just go to the next slide then. So yeah, I really just wanted to reiterate, like, we shouldn't be thinking of it as, are you doing telehealth or are you doing in-person? It's not an either or, and it's actually when we find that middle ground where we're not swinging between the two, and we look at how can we use both of these services to really enhance what we're doing. And that was, Fia, on the next slide, that was really this example that we put as a supplementary material to that article that Fee sent out, where it was something that was taken from the eHealth conference as a presentation, and Pierre very kindly allowed us to share it sort of as an open source resource. And it was really about how they have used this idea of using synchronous, asynchronous, in-person, virtual, computer mediated. They didn't quite get to the human computer interaction, but all those other things are things that we have available to us right now. And it's not about which one are you going to do, it's about which one does that person need right now. So in this example, they used a beautiful example of a hybrid approach where they did, first they did telehealth because they couldn't get access to the patient. When they could arrange an appointment, they did a home visit, and then one of the therapists was doing the home visit, another therapist was online. They could all communicate as a team and augment the service. And what Pierre had said to me afterwards when I chatted to her about it, she said the difference between the in-person and the telehealth was not the relationship. People think sometimes that you can't form a relationship over an online medium, but you can. She said the difference was just being able to accelerate the treatment with her hands on. And there's other studies that have looked at that as well, not necessarily specifically looking at telehealth, but there was a study on constraint-induced movement therapy where the therapists were looking at the parents doing the program at home and using telehealth to support the parents versus the therapist doing the in-person visits and not using telehealth. And what they found is when the therapist is in person with the patient, there's those subtle changes and subtle things that the therapist is seeing that they're able to augment how the parent is doing the therapy that you sometimes miss on telehealth. But still, you can form a relationship with the patient on telehealth. You can see what they're doing. You can update the treatment. And so this idea of using telehealth as a systems approach rather than as a second cousin is what I really want to do to get you thinking about today. Yeah, so I will leave it there unless if there's any questions.
Fantastic, Mindy. And if you want to hear more about what Mindy's been up to and what some of her hot ideas are around telehealth, there is a presentation that she did a couple of weeks ago that's available on YouTube under the Pediatric Society of New Zealand around one specific rehabilitation situation where she's co-designed an intervention using technology to support parents with home programs for children with high-level cerebral palsy. And I love your takeaway, Mindy, there about throwing the challenge out there to think about it in terms of systems and what is possible and stretch beyond the frameworks that we're normally used to thinking about things in and constraints imposed by service design currently. So finally, my question to you is, are you a grumpy cat right now? Are you like, oh, this is so uncomfortable, it feels like putting on wet gumboots, and maybe feeling uncomfortable? Am I comfortable with what I'm doing now and what I could do differently? Or are you like Mr. Adventure Cat? You might only be interested in the food at the other side, what this can achieve, but you're willing to walk a tightrope to get there, to put yourself out there and give things a go and take some risks. And overall, of course, the outcomes that we are wanting to achieve is families that look about as snug as that set of cats with their kittens there, about improving the access and the equity of services for children and families, getting access into services and improving the equity about the amount of services that people get. The gold in telehealth is that it gives the opportunity. It's not a cure-all for everyone by any means. It gives the opportunity for more people to access their services in a timely way and pay more attention to all those families on the wait list and the ones that don't even get to the wait list, as opposed to the ones that manage to get through all those hoops and get to the top of the wait list. So I'm going to say ka kite anō here. Thank you very much for your time today.